What's up, Oklahoma? This is Robert McMaster, candidate for Oklahoma House District 83 here. I wanted to jump on here and talk to you for a little while because there's some things that I want to make sure are available, and I want to try to get them all in one place. Not just with regards to Oklahoma, but also some of the things that we're hearing on the federal side with regards to the Wuhan virus. So I wanted to get on here and try and collect everything at once to let you know that there's a bunch of different things going on. There's a bunch of different things that we're hearing from a lot of different sources. So I wanted to get it all together for you. Now, before we get started with that, I want to tell you a little bit about myself. Again, I'm running for Oklahoma House District 83, and my name is Robert McMaster, okay? So if you go online to robertmcmasterforhd83.com, that's my website. You can check out some background information about me. You can look into my platform issues of healthcare, education, and criminal justice reforms. I think there's a lot of things that we can do better with regards to all three of those. Those are three very important topics here in the state of Oklahoma. And the way I've kind of taken a look at things is in the best interest of everybody that's involved. So definitely get on there and check out my issues. If you want to donate, there's a tab for that as well. I've also got a tab on here that you can volunteer. You know, it just takes a few moments. You just fill out a little bit of your information for me, and then I'll reach back out to you to see what your speciality is. If you're better with people as far as knocking on doors, or you're better with talking to people over the phone, or if you just want to send emails or text messages for me, jump on there, fill out that form for me, and then we'll get started and get cranking, folks. Also, while you're on my website, you can also check out media and look at different posts, different videos that I've been putting up. I'm going to try and do some more stuff while we're all kind of in shelter-in-place orders between the city, between the state, or whatever area you live in. So I wanted to make sure we get more information out there to you and across different areas of the social media universe. Okay? So let's start off with locally here in Oklahoma City. Now, a lot of you may have already heard or know that at the end of this week, over the weekend, Mayor Holt amended his executive order to try and match what Governor Stitt did with his shelter-in-place order. A lot of people have been told that the most important thing that he did was he kind of changed the name of it to kind of mirror what Governor Stitt did. He also made it enforceable, which means that the Oklahoma City Police Department can now issue citations if the business that you are doing is not essential, the trips that you are making are not essential. So, and there is a list on Oklahoma City's website as far as what's essential, and what's not on that list is considered non-essential. That being said, I don't agree with it. Last time I checked, this was the United States of America. Now, I am required by law, if law enforcement feels I'm in the commission of a misdemeanor, I am required to identify myself, and I will. Here's my driver's license. Here's my insurance. There you go. There's my identification. Past that, it doesn't matter. What I consider essential, the officer outside the window may not consider essential. So there's a difference of opinion here. And just because it may not be on Mayor Holt's list doesn't mean it may not be essential to me and my family. So I understand that we have a very contagious virus that's going out there, the Wuhan virus. It's very contagious. There's estimates that it's contagious as far as 1.6 people for every one person gets it, all the way up to some estimates have it at 2.6 to 3. So I get it, it's very contagious. That's why we're practicing social distancing. We're keeping our hands washed more so often than we normally would. We're using hand sanitizer as much as possible. That and toilet paper, it's hard to get those items right now. So, but we are doing these extra measures to make sure we are practicing better habits or more habits of cleanliness, and we're trying to keep more distance between us and another person. And that by itself will do a lot to stem the spread of it. But I don't think we need to bolt ourselves in our homes and weld our doors shut. This is not communist China. This is not the Soviet Union. This is not Nazi Germany. This is the United States of America. Last time I checked, we have a Constitution. The last time I checked, life, liberty, and the pursuit of happiness is in that Constitution. So, practice those social distancing and sanitation regulations and guidelines from the CDC. But look, if you need to go out because you got to work, if you need to go out because you got to do stuff for the house, it doesn't matter if it's on an essential list or non-essential list. That's your choice to make. I don't agree with doing a citation. I don't agree with threatening people with jail time over, I just got to run to the gas station to pick up something for the house. What is essential to me may not be essential to the next person. So it's to each his own. Take care of yourself, protect yourself, but I don't agree with a shelter-in-place order, because I have a family I have to take care of. I have elderly people in my family that I also need to make sure that I'm able to take care of as well. I understand my mother may not be able to leave the house because she's at highest risk. That's okay. I'm going to try and make sure that I help her out when I can. If she needs something, I'll be more than happy to go get it. The same thing for my family. But that's for me to decide, not the government. Okay? So to each his own. Let's practice some social distancing, some extra cleanliness now, so we can try and stop the spread of this thing. And so let's keep on going. Okay, so let's check out how the Wuhan virus is affecting on a national level. If you go to a lot of different websites, and as you can see this one here behind me, you can see that we have about 125,000 confirmed cases here in the United States. Most scientists, or most scientists, would say that number is probably much higher. We're just need to crank more tests out there. Here in the state of Oklahoma, Governor Stitt's kind of gotten the private sector into this to generate and crank out more tests. Not just the private sector, but also OU, OSU. So he's getting with all these different organizations to get testing kits cranked out there, so we can try and get as many Oklahomans tested as possible. But I guarantee you, it's a lot higher than 125,000 people. As you can see from this map, some of the biggest hot-blooded areas where the most of it is the most heavily populated areas. Seattle, San Francisco, Los Angeles, New York, parts of Florida, parts of Louisiana, Houston, Dallas. All these metropolitan areas are where the biggest amount of it is, because you have the most amount of people. Now here in Oklahoma, you got Oklahoma City, you've got the Tulsa area. Outside of that, you don't really have any large swaths of it because people are more normally spread out. Deaths, we're sitting at around 2,300, almost 2,400. Folks, that's a lot less than everywhere else in the world. We're only running at about 1 to 1.5% of the amount of cases are actually people that are dying. We want that number to stay at 1% or lower, okay? Because that means that we are doing a good job as far as social distancing, as far as the extra cleanliness regulations. The other beautiful thing is over here in this far right-hand column, we have 2,600 people that have recovered. Now, that number also probably is just an estimation, or that's only what they can confirm. That number probably is a lot higher as well, because we're guessing when all of this started. We're guessing that it started in December. It could have been a little bit earlier than that, but December was when everything just blew up in China, okay? So we got to keep those things in mind. But as long as this number keeps climbing, the total confirmed cases and the total number of deaths slowly goes up or stays the same, that's a good thing. That means we are getting control over it. People can start to go back out more. But here in Oklahoma, guys, this is what we're sitting at right now in Oklahoma, okay? We have 429 identified positive cases, okay? Now, we do have 16 deaths, so our percentage is running, kind of a little bit higher than the nationwide percentage. But again, the same thing applies in Oklahoma. As we get more positive cases, the death rate will go down, okay? So, but we are cranking out more tests, so those numbers will start to go up, and we will start to get better data on this, so we can start to actually find out where we can start opening up the economy, okay? Because this is a seesaw between healthcare and economics. You don't want to play around with this. Our healthcare is important, but we also got to be able to put food on the table. Let's not misunderstand. These things are not mutually exclusive. It's a seesaw balancing act of both, okay? We do want to keep people healthy, but we also got to keep in mind people also got to pay the bills and put food on the table. Because last time I checked, April 1st is around the corner. Rent's still going to be due. Mortgage is still going to be due. The utility companies have said that they're willing to push back the bills until later on. but they didn't say they were going to wipe them out. You still got to pay for it. It's just down the road. So every single person out there needs to make the judgment call themselves as to whether or not they want to go to work, as to whether or not they have to go to work. But again, that's each individual's choice. Some of us have families to take care of, whether they're young children, whether it's a spouse, whether it's older parents, whether it's older family members, aunts, uncles, things like that. We all have different reasons for why we do things. Some of you can stay at home. If you can, by all means, you do what you think is best for you. If you are one of the vulnerable population as far as age, or if you have a pre-existing condition, immunocompromised, diabetes, different other diseases that might make your body more susceptible to getting it, by all means, stay at home if you want to. Okay? You're taking the risk of your life, and I understand that. But I also understand that folks like myself who have a family to provide for, who has bills that they have to pay for, who has to be able to put food on the table, keep the lights on, keep a roof over our head, those things means I need to keep working. But again, I will practice the social guidelines. I will try and do the distancing thing as best as possible that my job allows for, but I got to work. If I start getting a scratch in my throat or getting a fever, any signs or symptoms that might go along with this, then that's one thing. You have to work your life around what you think is best, but you have to actually sit down and have that conversation with your loved ones. You got to sit down and think honestly and rationally about it too. If you can work from home, let's do that. If there's a percentage of the job that you have to go into the office, see what you can do to try and make that remote. There's a lot of different things that you can do out there technology-wise to try and make more things remote for your job. All right, so let's kind of go on to the next thing here. The state of Oklahoma has created a website for a bunch of different resources with regards to, as they put it, COVID-19, but it's the Wuhan virus. This page is to serve as a resource for Oklahomans for a bunch of different things. There's the first section is for social media, so that you can follow along with the different messages from not only the governor but his staff. And then it's got a bunch of different sections over here depending upon what best fits you, for health updates, for businesses, if you're a small business, if you're trying to find a job, if you have lost your job because of this, you can click on the Oklahoma Workforce and Jobs resource. Because I will say, Amazon's hiring, Walmart's hiring, big box retailers, Crest, grocery stores. Reach out to these people and see if they're hiring. There's tons of places that actually aren't because of the fact that their demand has skyrocketed. So big box retailers, grocery stores, things like that. But that's a good resource on that website, Workforce and Job Resources. Because if you can stay working and you can do parts of that job from the house, or you can practice social distancing to try and limit the spread, by all means, keep doing it, folks. If we can keep the economy somewhat chugging along while other parts of the economy kind of have to shelter themselves, it will lessen the blow after we get out of this. Okay? Because just as much as we're trying to keep people healthy and trying to keep the Wuhan virus from spreading, we also got to keep in mind that homelessness, mental breakdowns, mental issues, drug and alcohol abuse, those things kind of come along with economic problems. Because when you can't afford to put food on the table, stress piles up with those things. So it's like I said, it's a seesaw. They're not mutually exclusive. It's not black and white, one or the other. They work together. It's just figuring out the best balance of both. Okay? So we got this great resource on here that the state of Oklahoma put together for you. And you can also subscribe for updates. You can click on there, put your email address in there, so that as the site changes or it adds something or another message comes out with an update, you'll get it. Then the state of Oklahoma created this website. This is to help you find local organizations to fit your different needs by county and by what you need, so that a lot of those not-for-profit or government organizations that already might have some supplies as far as food, clothing, baby needs, things like that, you can find them. Okay? That's what we're wanting to do here, is we're wanting to get all these resources out to you in one place. Now, on the federal side, the federal government also created a website as well. And actually, this is for Oklahoma as well. Sorry. This is for small business loans. Okay. The SBA has opened up a lot of low interest federal loans for businesses that have been directly impacted by this, because these businesses have to stay alive. If we lose a lot of these small businesses, a lot of these corporations because of this, there won't be any jobs for us to go back to afterwards. So we have to find ways that we can try and keep these businesses at least chugging along, so that when all this is over with and the sectors of Oklahoma and the U.S. go back to work, there's jobs waiting for them. So there's different things that you can do. Restaurants, takeout, delivery, to go, a bunch of different things you can do there. If you want to, if you're not really hungry for anything right now, go and get a gift certificate from these businesses. Call them and see if they don't normally do it, if they'll develop it for this, so that we can keep generating some little bit of fundage here and there into these businesses to keep them going, so we have places to go back to. But the Small Business Association for the federal government also opened up a lot of loans for this, so that they can kind of keep chugging along and also keep people employed, so we can try and keep the amount of unemployment claims to a minimum and people still get actual paid. We got a property damage website as a part of this as well that you can take, so that we can try and see if we can get external resources to you through the state or federal level. All right, we're going to kind of shift topics here and talk about the media, because as we all know, mainstream media, they've been pushing a lot of narratives out there. A lot of them have been more doom and gloom and how this is just scary and it's the worst thing ever. Is Wuhan virus contagious? Yes. Does the Wuhan virus kill people? Yes. Is it the end of the world, the Black Plague type things? The data is showing us that it is not. But we didn't have any information to go off to begin with, so we were pretty much having to follow all of the different data models that were thrown out there by different organizations, whether it was universities in Oxford, universities or in the UK, universities here in the US. But now those models are being changed because we have data going into them to where things are not so dark and gloomy like we were all being told at the very beginning. So you can go in this and kind of look at these different models and see what they're talking about now since they've changed, where some of the models that were saying we were looking at 500,000 deaths in certain countries or over millions of deaths in certain countries now have dropped to a lot less. So those models are getting more precise as we're moving along. So definitely check out that as well. President Trump is working on classifying individual counties based on their Wuhan virus risk. That's what they're working on over this next week as far as high risk, medium risk, low risk. That's going to give us a better idea as to whether or not we can open up certain sectors of the economy so people can go back to work. Because again, like I was talking about earlier, healthcare, economics, they work in conjunction with each other. They are not mutually exclusive. It's a seesaw, okay? So we have to figure out what sectors can go back, what we need to do as far as when those sectors go back, what extra things we need to do, like social distancing, providing hand sanitizer at work and for customers. Like I know some businesses, when you walk in, they have a hand sanitizer pump right there on the front desk as soon as you walk in with a sign that says, please take a pump before you come in. You come in, you take a pump, hand sanitize. That helps everybody. So we'll see what happens later on this next week or the week after to see how counties in Oklahoma are classified. But now let's start talking about the order for Kevin Stitt, shelter-in-place order. This order was designed to try and make a lot of recommendations. It was designed to try and keep the vulnerable population out inside their homes as much as possible, so they're not intermingling and getting out there and possibly stand a higher risk of not just getting infected, but a higher risk of actually dying, because we don't want people to die. So inside this order, he put it in there that if you are one of those vulnerable people, whether it be age or if you have a pre-existing condition already that you are aware of, the request was that you shelter in place and stay inside, okay? And that kind of will help not really stem the spread because other sectors are still okay to go, but it keeps the death rate low. That's what we're aiming to do, is to keep the death rate low. The quicker we can get the Wuhan virus kind of taken care of as far as getting confirmed cases down and keeping the death rate low means we can start actually intermingling again, because there's a lot of different things going on here in 2020, a lot of different things being affected by this here in 2020. So we want to make sure that we get proper information out there to you, so as quickly as we can actually open sectors up, you'll know about it. So the other thing that this order did is that it created essential and non-essential based on federal guidelines. So it talks about medical here. It talks about different occupational licenses, because what he did in this order was opened it up to health nursing licenses. If you had one that was expired or it lapsed, you were able to get it renewed so you could get back out there and start working, because we do need more nurses. We do need more people that can work at healthcare facilities so that people can get help they need. The private sector has now been opened up across the U.S. to start making more medical equipment. So like auto manufacturers, they now can start creating more ventilators. Clothing companies can start making masks and gowns and things like that. They're not specified to just the medical equipment industry. It's been opened up across the board, which is a good thing. That's why it's best to be in this country right now. We have a private sector that can be opened up to take care of everything that the country needs. And that's exactly what we're doing. So, we're going to get more ICU beds. We're going to get more ventilators. We're going to get more gowns, more masks for our medical personnel. And the private sector is going to start cranking this stuff out. So you're going to see a lot of positive things happen over the next couple of weeks. Labs are also being allowed to start cranking out these test kits. So we're looking at, I believe one of the universities said that they were going to be able to crank out around 10,000 kits. So as soon as we get more of these kits cranked out, people can get tested more. We can find out more accurate numbers, so we can start actually getting people taken care of. And then we can start seeing how much we can get people healed, get the recovered rate up. Because once you're recovered, supposedly you're supposed to have an immunity to it, I guess, is what the science says, to where we can start intermingling more and getting out there, okay? It also stops prescriptions on, now, I'm not a pharmacist, okay, so bear with me. Hydroxychloroquine, I believe the name of it is, so that it can be, no prescriptions are going to be allowed for it unless you have been diagnosed with COVID-19, the Wuhan virus, or unless you have to have it refilled for another pre-existing cause, so that we can try and keep our supply of it for people that have the Wuhan virus, okay? Now, here it talks about the vulnerable populations like I was talking about earlier, age or pre-existing conditions. So, and then as we keep going through here, and you can read it for yourself, it starts talking about different relief as far as different supplies that are needed. They're putting a moratorium on purchasing those to kind of keep them specialized just for the medical industry. But it kind of goes over everything. This essential business inquiry is another one that I wanted to actually talk to you about. The state of Oklahoma understands that the federal list does not cover every single essential business. So they set up a website so that you could actually make a request to be clarified as an essential business, so that you can stay open. You don't run into the potential legal issue of being open when your business is supposed to be closed. So that is definitely a good resource to have. This is another kind of health website that's kind of tracking things here in Oklahoma. It breaks everything down for you as far as the testing, breaks it down by the age groups as well as the deaths, so we kind of get a good idea. Does it by gender, by county, kind of breaks everything down so we know what's going on, where it's going on, how it's going on, who it's going on with, the whole 9 yards, okay? All right. Here's what I was talking about earlier with Amazon, Walmart. There are a bunch of companies that are actually going to hire people because they need employees to handle extra, to necessitate the extra demand for their business. Walmart's on here, Amazon is as well, other big box retailers like Crest, probably Target too. Reach out to all these big corporate retailers so that we can actually, some people who might have lost their job, they can get some extra temporary work until all of this passes and we get back to work at our normal jobs. Unemployment. As of the 26th, we hit a record 3.3 million unemployment claims. That is 5 times higher than the previous record in 1982 of roughly about 600,000. This is what we're talking about here by the seesaw effect and of healthcare and economics. We can't just look at this thing just from the healthcare statistics. We have to look at these things from the economic statistics as well. We can't just say everybody stay home. If we do that, we're going to have a lot of people out of work. A lot of companies and corporations are going to shut down because if they can't afford to stay open, they're not going to. They can't afford to keep people employed. If they can't afford to keep paying vendors and paying their employees, they're not going to stay open. So we have to find a way to keep these businesses open, keep these corporations open, along with making sure that we're not getting more people sick intentionally, okay? This number is going to get a lot higher. This was just off of 1 week. We have to see what we can do as far as stemming the flow of the Wuhan virus and trying to keep people working. So we need to make sure we're watching these numbers very, very closely, because if we end up in an economic depression after all of this, it's going to get real bad out there, folks, okay? That probably scares me a lot more than the Wuhan virus does, to be honest with you. Now, this article right here from the Washington Examiner kind of talks about what I was talking about earlier, the free market. Because we have a free market economy that the government can request or buy products from, it energizes this market to do exactly what the people of this country need. If you want to talk about government control of everything, just look at the European Union and what's going on over there. Italy, they were averaging on some days 600, 700, 800 deaths a day. A socialized healthcare system. Their country also has a lot more of other government control situations. They had to go into a full lockdown, and it still wasn't stopping the death rate. Well, here in the U.S., we jumped on this early. We had the ban of travel from China, and then as cases started to jump up in the European Union, we put a ban on travel from there. Because we were already in the midst of building a border wall, it was already stemming the flow of illegal immigration. So it allowed us to stem the flow of people being infected coming in from the southern border. We shut down the southern and northern borders now, so we're pretty much trying to keep, unless it's essential trade or something along that nature, we're trying to keep people from getting into the U.S. that potentially are affected on all 4 sides. Okay. Now we're invigorating and energizing the free market to produce and provide what we need. Different manufacturers are being set up and to create medical devices, to create medical clothing, to create other protective gear like face masks, so that we can get this gear out to all the hospitals in the U.S., so that we can do everything that we can to keep that death rate low, to start getting a handle on those confirmed cases, starting to get people from the confirmed diagnosis over to this category on the far right, as I showed you earlier, from the total recovered. Because as we start getting the herd immunity, as you've heard about in multiple locations, as people become immune to it because they've had it, their body's built up the antibodies of it, now they can get back out there and get to work. That's what we're trying to do, and the free market here in the U.S. is the best way to do that. So this article kind of goes into a bunch of different things, talking about 60% of the U.S., their jobs can be done remotely. That's a great thing. That means 60% of the workers are not going to be filing an unemployment claim. They're going to be able to stay at work and continue to produce for their employers so they can continue to bring home a paycheck. So we've got some positive numbers out there. This is not all doom and gloom. If we go down in this article some more, because of the fact that we do have this abundance of free enterprise here in the U.S., we've got a bunch of different sectors we can pull from to try and get what we need out there a lot faster. In other countries, they don't have that. It's more government control, it's less freedom, so they don't have the capability to do that. So this is why I say this is the best place for anybody to be right now, is in the U.S. We have the most intelligent people in the places where they need to be, so that we can do the best we can do in the quickest amount of time, so that we can beat this virus and then get everybody back out there to work. Okay? So, in conclusion, there's a lot of resources that you're going to see. There's a lot of links that are going to be available for you to click on. Click on the links, look at these resources, take a look at these articles, because all the information that's out there is not 100% doom and gloom. This is not the end of the world. This is the country that's going to survive it the best, because the fact that we have done the impossible multiple times. We've gone through multiple world wars. We've gone through multiple great recessions. We've gone through a Great Depression. This country, time and time again, has shown the world we will not be beaten. We will stand tall. We will stand together. We might fight amongst ourselves sometimes, but this is the United States of America. We are all Americans here, and we are all in this together. There's things that we can do for ourselves. There's things that we can do for each other. Practice those social guidelines. Practice those extra sanitary guidelines. Try and stay to work as much as you can and practice those guidelines. If you need to go do something, go do it. Don't be afraid of an executive order or the government telling you that you can't. Again, this is the U.S. But we are going to get through this together, folks. There's a lot of resources in here. Take advantage of them. Use them. Make those phone calls. Reach out. If you know somebody that lives close to you that might be in that vulnerable section that I was talking about, leave them some food on their doorstep. Give them some help in some ways. A lot of people do own houses, and they may not be able to get their grasses cut. They may not afford to. There's a lot of things we can do to work together to work our way through this. But I wanted to get on here and put all this information in one place so that you could see that the numbers are not all doom and gloom. This isn't the end of the world. I wanted to get on here and talk to you to let you know that we're all still here. We're all still talking to each other. I want you to reach out to me. I want you to send me a message. You can message directly through my website at robertmcmasterforhd83.com. It's got a contact page on it that you can fill out. You can send me a question. You can also reach out to me through the email at robertmcmasterforhd83@gmail.com. The easiest thing, you literally can go to Google and type in Robert for HD83. And you can find me very easy. There's a bunch of different, I've got a Twitter, I've got a Facebook, got a YouTube. I'm going to continue to post videos up everywhere in the social media universe so that you can see what's going on. It's not going to be all doom and gloom. I'm going to try and spread information out that I can to try and, give you resources, give you information, let you understand this is not the end of the world. We're going to get through this. Do we have some problems going on right now? Yes. Are we trying to solve them? Yes. But it's only going to work if we're working together to do this. The fighting We're going to put that away. Doesn't matter if you're right or left, Republican, Democrat, Libertarian, Independent, Conservative, Socialist. It doesn't matter. Right now, all of us are Americans. In Oklahoma, all of us are Oklahomans. It's time to put the infighting aside and work together. Let's pass information around. If you see an article, post it up to your Facebook, your Twitter, your YouTube. Send it to me. I'll post it up to my Facebook, my Twitter, my YouTube. I'll continue to do videos for you folks because I want this information out there to you. I want you to understand that I'm not just running for a public office. I also want to be there to help you because I'm working today for Oklahoma's tomorrow. Again, this is Robert McMaster. I'm a candidate for Oklahoma House District 83. You have a nice day, folks.